Hi everyone, I'm Dr. Farr. Fibrosis is often called a wound that never heals. But what does that really mean? Let's break it down, step by step. When our tissues get injured, the body kicks off a carefully choreographed repair process. First comes inflammation. Immune cells rush in, clear out debris, and fight off infections. Then fibroblasts, the builders of connective tissue, get to work. They produce extracellular matrix like collagen to patch things up. Once the wound is closed, the process shuts down and normal tissue function is restored. But what if the tissue keeps getting injured by toxins, long-term inflammation, or ongoing stress? The repair cycle gets stuck in overdrive. The body thinks the wound is still open, so it never fully resolves. In this cycle, fibroblasts become hyperactive. Many even transform into myofibroblasts, cells that are like repair workers. They pump out collagen and contract like muscle, pulling the tissue together. Normally, these cells disappear once the job is done. In fibrosis, they refuse to leave. As this continues, collagen piles up faster than the body can break it down. The tissue gets stiff, thick, and scarred. Over time, this scarring changes the organ structure and blocks its function. Stiff lungs in pulmonary fibrosis, a hardened liver in cirrhosis, or thickened skin in keloids. So, what makes fibrosis different from normal healing? It's the lack of an off switch. Normal wounds heal and stop. Fibrosis is like a wound that never turns off. Repair becomes scarring, and scarring becomes disease. In the next video, we'll dive deeper into the cells that drive fibrosis. Fibroblasts, immune cells, and how they all interact in this process. Stay tuned.